Now let's look at post-op pain. Let's say that we have a carpal tunnel incision. And if you want, I can use this arm. And so let's say that now she has a carpal tunnel incision, and I want to treat about 1 centimeter intervals close to the margin of the wound, okay, followed by 20-second sweep across the wound bed. And just for a moment, I'm going to show you close up the difference of a sweep versus a contact. Okay, so for the post-op pain with the carpal tunnel, I am going to treat as close to the wound as possible. If you can get contact, that would be good. And just let me show you, like I said, the different techniques. Contact would be actually making contact with the skin or the targeted area. You can do light compression and just press down, because remember that helps push the hemoglobin away. Or you can do a sweep, and this is what I wanted you to notice. So when we say sweep, this is what we're looking at, okay? And if I'm using the cluster, the same thing, I would just, hold it there for contact. And then if I'm doing sweep, okay? Now sometimes in wounds, if there's no skin, then you would want to put like a cellophane. You can use just your cling wrap from your kitchen. Put the cellophane over the laser, and then you can treat, okay? Or you can even take the laser and have it hovering over the wound and not having direct contact. Just remember, when you do that, you're going to lose some of the light. Another thing you can do if you're treating a wound that does not have skin is that you can do tegaderm. You can put over them. Now remember, the Thor is approved for musculoskeletal, not the wounds, but these are the hints for the things that you're doing. Okay, so now back to the post-op. So we're at post-op pain. She had carpal tunnel and she has pain. So what I'm going to do, let's say she's seeping a lot, then obviously I could do my cellophane trick. I could put the probe on her, and I'm going to put my beam on, and then I'm going to hold that there for a good 20-30 seconds, and I am going to be doing this too at about 20 hertz. You can do it continuous too if you want. But then when I'm done with that, I'm going to do 2 or 3 of them. Then I'm going to do a sweep. Okay? If they're having a lot of pain because they still have sutures in and they're sticking out and just moving that is bothersome, then obviously you can just, like I said, do the hover approach, and that would be fine. Now let's look at a shroud ligament. What's the other name for the shroud ligament, Susan?
Sagittal band.
Sagittal band, thank you. I had a little moment, I couldn't think there. Okay, so we have the sagittal band or the shroud ligament. I'm going to treat this 3 points. And what I mean by that, I'm going to use a single probe, and I'm going to treat per point. So this would be a point, this would be a point, this would be a point on my dorsal, and then on the volar, I'm going to treat 2 points, and I'm going to treat right in this area and then over in this web space, if you can kind of see that, okay? And what I'm going to do 3 times a week, 3 days a week, I'm sorry, to every day, to 5 days a week. I'm going to use my single probe, and I'm going to do it continuous for 15 to 20 seconds. I want to deliver anywhere from 2 to 4 joules. If I'm going to do 4 joules, then I'm obviously going to do it for 20 seconds. I can do a pulsed frequency too of 2.5 hertz. And like I said, treat it for about 30 seconds. As the condition improves, I'm going to decrease my frequency.